Hello, everyone. Good evening. Welcome to the Marriage Clinic. This evening, our conversation is dealing with spouses, coping with spouses with addiction problem. So that's our conversation today. There's quite a number of questions that I have received, and we will be talking about these questions. But let's go straight into it. Let's start first with how do I even know that my spouse, hello, say you can't hear me. Can you hear me now? Can you hear me now? What's going on? Hello? Hello, can you hear me? Please let me know once you can hear me. Can you hear me? Hello, can you hear me now? Hello, can you hear me now? Please let me know once you can hear me. Can you hear me now? Hello. Okay, fantastic. Okay, I think I mistakenly pressed something. Okay, so good evening, everyone. You are welcome to the Marriage Clinic this evening. Our conversation this evening is coping with spouses with addiction. The whole idea here is how do I, number one, identify. So the goal of this conversation, how do I identify my spouse with if my spouse is having a problem, and for those who are addicted, how do I even know if I am having a problem with addiction? Then the third goal here is what do I do? How can I help? And then we'll take the specific questions. So I'm going to do this conversation hopefully in 20 minutes, then go in right into the questions and answering the questions. So you're all welcome. I am Dr. Otefe Edebi. I'm a consultant psychiatrist, and I am also a psychologist. I'm the medical director of Grace Hill Behavioral Health Services Limited. We are our facet at Amo Odofin, and we specialize in mental health issues and addiction issues. So today I'll be talking about addiction, how you can help your spouse. Okay, so how do I know I'm addicted? So we're talking about various forms of addiction this evening. We're talking about substance addiction. Substance addiction, another word for it is drug addiction. We're talking about how do I know if I'm addicted to pornography and masturbation, kind of hand in hand. And how do I know if I'm addicted to gambling? How do I tell that I am addicted, or a friend of mine or my spouse? We're talking about marriage and your spouse. So first things first, I'm going to take them one by one. First things first is for drug addiction. So there are basically seven things we ask. About addiction. Number one is, do you feel a whatever it is? It could be alcohol, it could be marijuana, it could be pentazocine, it could be tramadol, it could be cocaine, crack, whatever drug it is, as long as it wasn't prescribed and it alters your mood. So any drug that can alter your mood has a and you abuse it and you take it unprescribed, and every time you notice you have this urge to use the drug. That's number one. So there's a compulsion, there's a strong urge to use the drug. Number two, do you find yourself over the years, you find yourself having to increase the quantity of this drug? So let's say that in the past you will take a certain amount and it will be just enough. For example, weed, you may take, maybe when you started out, you could only smoke half, and that half was enough for the day, but as you progressed over the years, or it could be alcohol, one bottle, and then you have progressed to 2, 3, 4, maybe it's Refnol, you're using medications, you may whatever the reason is. I'm not focusing on the reason why you may be taking it. You may say, oh, I take it just to help me sleep, or I take it to help me perform, it helps me sexually, or it helps me at work. Whatever the reason, the fact is that you have increased your quantity. Now, once you have increased over 50% what you used to take, and that means, what I mean by that is that you need to take more to be able to get the same desired effect. So maybe in the past, when you take a certain amount, you feel good, you feel happy, it's just quite okay. Now you need to take a bit more, and when a bit more, once it's over 50% over time, and then it increases 50, 100, and whatever, 100% and much more, then you have developed what is called tolerance. So that is number two. First is compulsion, second thing is tolerance. Then for some kind of drugs, not all drugs, there's something we call withdrawal. So every time you stop, or you try to stop taking this drug, you experience some form of discomfort. So for example, those who take alcohol, when they try to stop taking alcohol, they experience tremors, they may experience restlessness, they are agitated, they are irritable, it's very hard for them to focus. Same thing with weed. For weed does not necessarily give withdrawals, but things like heroin, tramadol, opiates, codeine, all of them in that group, the pentazocine, you find out that every time you try to stop it, you feel very unwell. You may have a stomach discomfort, which is basically, you may have diarrhea, you may find it difficult to sleep, you may find it you may be very restless, you may also have aches and pains all over your body, so you have a discomfort every time you try to stop. Or for crack, you find yourself itching and scratching, and just generally then you find yourself also very, very, very depressed every time you try to stop. Those are called withdrawal symptoms. There could be some form of irritability. You get upset easily. Same thing with nicotine, cigarettes, and so you try to stop cigarettes and then you find yourself. So this is how it plays out. Sometimes you find yourself saying that I need to take it to function. So you can't read effectively if you don't take the drug, or you can't walk effectively if you don't take the drug. Then for some people, they say, oh, I'm trying to avoid pain. If I don't take my drug, I'm going to have some form of pain, physical pain, like those who are on pentazocine. So I'm taking it for the pain and all of that. So if you experience that discomfort every time you stay off the drug, that is some form of withdrawal. That's 3. And another thing is something called reinstatement. So you try to stop, you may even have succeeded, or you may have just the thoughts to stop. You may have succeeded, but you went back. You stopped for a week, for 2 weeks, for months, but you went back. That's reinstatement. Another thing we look at is do you find yourself continuing to use despite knowledge of harm? So many people have told you, and even you, maybe they didn't even tell you, but you yourself, you can tell that this drug has impacted on your relationship, on your family life, and in terms of, we're talking about marriage here, so it has impacted on your relationship with your spouse, and all of this is going on, and then you continue using. So you are using despite knowledge of harm. Once you have 3 out of all these things that I've mentioned, then also you find yourself choosing to do drugs, or choosing to stay with the drugs. So you may isolate yourself, you may prefer your own company, just because, or you may skip an important thing. So you may have a job to do, or a responsibility to take care of, and you find yourself putting drugs above it. You may say, well, I'm not doing that, but the reality is that you would rather do drugs, sometimes even rather do drugs than have sex. It just takes everything as a couple. So you could be a wife, you could be the wife abusing drugs, it could be the man abusing drugs. We are not talking now. Most times men are the ones that abuse drugs more than women, but women also abuse drugs. So you could find yourself lack of sex drive and all of that, just choosing to do that, lack of motivation to work, to go out to work, and you just want to do drugs. Now, having mentioned all of this, so if you see these things in your spouse, you should begin to suspect that they may have a drug problem. And so I have mentioned basically six, and then you find yourself finally, and then the seventh one and the final one is that if you also find yourself so sorry about that. If you also find yourself spending more time than planned seeking for the drug, using the drug, and recovering from drugs. So, for instance, you say, I'm just going to spend 2 minutes, or I'm just going to take one stick, or I'm just going to take one wrap, and then you find yourself spending more time than you planned, seeking for, using, and recovering from use, then you have a problem. Now, if you have just three of these things I've mentioned, I've talked about primacy, putting the drug above every other thing, compulsion, a desire to use, reinstatement, you stopped using, then you went back, tolerance, over time you have had to increase, withdrawal symptoms, every time you try to stop, you experience a discomfort, spending more time than planned, using, all of that. Once you have three out of all of this, then you may be struggling with an addiction. And if you see that in your spouse, so what you will normally see is that you may see the spouse spending, so money is always finishing, the person is always lying, the person doesn't seem to care about any other thing, things are deteriorating, but the person is just seem not to be bothered. Now don't get me wrong, they are bothered, but one of the things that drug will do, and to continue using drugs, you have to put yourself in that place of denial. So a lot of people deny that they actually have a problem. That's for drug addiction. Now, gambling. Let me share some myths I came across that I think is of important. So when people have gambling problem, they also, just like drug, they are in denial and say, oh, I don't have a drug, I don't have a gambling problem. So they say, well, after all, I don't gamble every day, so I don't have a problem. Now, you don't have to gamble every day to have a problem with gambling. Once you notice that my gambling, impacts on certain things, so my finances are being affected, my job is being affected, or even my relationship. So it could be that you have enough money, to gamble, and say, well, it's my money, I'm gambling, but it's affecting your relationship. And then you say, then you find yourself hiding just to continue your habits, then you have a gambling problem. Another, which is the other myth, is problem gambling is not really a problem if you can afford it. That means you say to yourself that as long as I am not stealing to do it, then no. If it's too much gambling, can affect you relationship wise, like I talked about, and it can also cause depression and anxiety and even suicide. I mean, if you lose and all of that, it can impact on you. So it's still a problem. Also, another myth is that having a gambling problem is just a case of being weak-willed, irresponsible, or unintelligent. Some people think that, okay, gamblers are weak-willed, they are unintelligent, they are irresponsible. Well, you may start out gambling by choice, but when it becomes an addiction, you may find it very difficult to stop, and you just find yourself keep going back, even though it's impacting on family members and it's impacting either on your finances or even on your job. It's then there's another myth too. People often say, okay, it is the way the house is, that's why I gamble. I like to just go and hang out. It's because my loved ones, they pushed me to gamble. Look, that is not right at all. That's you just trying to blame others and to avoid taking responsibility, and you want to push it on others. So it's not correct. And then the final myth is that many times people, loved ones, so you are a spouse to someone who gambles, you often feel that you should take care of their debt. Let me say this, that's a wrong move. If you take care of the debt of a gambler without dealing with the primary problem, it's likely going to accrue another set of debt or bring another set of problems. So that is for gambling. If you feel the need to be secretive about your gambling, you don't want your spouse to know, then you may have a problem. If you have trouble controlling it, you are spending money every day or most days or every Friday. Like I said before, you don't have to gamble every day to have a problem with gambling. If there's a particular day, once you get money, or once maybe it's every Friday or every end of the month, it could even be every end of the month, you spend a significant amount of your money just gambling. And then if you also find yourself even gambling when you don't have the money, that you are stealing from here and there and going to put it just to gamble with it, then you have a problem. And finally, of course, if family is worried, your spouse is worried, truly you have a problem. If you yourself feel that you have a need to cut down on your gambling, then there's a problem. Then the final thing, we're talking about addictions. So I've talked about drug addiction, I've talked about gambling addiction, I'll talk about the self-helps, the things you can do for whether you are struggling with substance abuse, whether you're struggling with gambling, or now the final one is pornography and masturbation. Now, I think this is it's quite important for us to understand some things. So some people often feel that, well, there's no big deal about it, no big deal about porn. But if you find yourself, so how do you know you have a masturbation problem? If you feel this strong urge to masturbate, and most times it's like there's a pattern. So it could be in the morning, it could be at night, maybe every time you come back from work, and then you masturbate. And then also, if you find yourself just masturbating for just the urge sake, that is not like even like you are sexually aroused or something. It's just that you come home and then there's this strong urge. And sometimes it could even be in the workplace. You find a strong urge to go into the toilet or go to a private place just to masturbate, not even because there's even any particular sexual stimulation. You just find yourself wanting to do that. Then of course, if the masturbation begins to impact on your relationship, and despite that you keep doing it, it's impacting on your life, it's impacting on your quality of your life. Sometimes you may masturbate so much, you are so tired all the time, and yet you keep masturbating, then there is a problem. It's something that you should ask for help. And then if you find yourself knowing that, okay, I think I have a problem and I'm trying to stop, but I can't seem to stop. I know there's a problem, and I want to stop and I can't seem to stop, then truly there is a problem. You may just have a problem with masturbation. And same applies to pornography. Now, porn has effect on your body. I'm going to start from the last and then go ahead and take the questions. Okay, great. I just want to open. Please, I want you to do me a favor. I know you are listening. I want you to send the questions again to me via WhatsApp. That way I can see it and then I can take the questions. Please send it again to me via WhatsApp. I know you sent it before, but send it again. That way I can see it and then take the questions one by one. What do I do if I have these problems, if I have an addiction problem? Okay, so there are basic things I always share and say that you must try to do if you have an addiction problem. Number one, expose it. Expose that problem. Every addiction thrives in secrecy. Every addiction thrives in secrecy. What do I mean by that? Many times one of the ways we try to deal with addiction, which is not very effective, is when we try to do it all by ourselves. We want to do it all by ourselves. So, and the more you try to do it all by yourself, the more you realize that it's like a vicious circle. You are just struggling, you are still there. So please expose the problem. And when I say expose the problem, talk to someone. And in this case, talk to your spouse. Now, how do you help your spouse that is struggling with it? Please, it's very important that you don't become judgmental. Now, it's a struggle for the person. Sometimes it's outrightly embarrassing for the person. So they are literally embarrassed by the problem, and they want to keep it secret as much as possible. So if your spouse opens up to you to say that, dear, I have an addiction problem, whatever it is, whether it is a drinking problem, or porn, or masturbation, or gambling, please expose it. Then if your spouse is unwilling to expose it and you know about it, the thing I would suggest to deal with that kind of thing is to have a conversation with the person. So start out like this. You be the first person to take the approach, one-on-one. Don't start out the conversation by going to call the whole village or call his family members. I mean, you've not had the conversation. And be as gentle as possible. Don't be confrontational. Some will call so don't be confrontational with the person. Now, even people who do all of these things, they have their good sides. So it's not just the moral thing. When someone becomes an addict, it's not that, oh, you forget all the good sides of the person, and then because you are so overwhelmed by the problem and by the negative side of the person, you forget all of that and you just attack the person. So the basic principle of communication is come towards them, and have a conversation from an empathic point of view, that I notice you seem to be struggling with this, and I think it may be a problem. You are not sounding judgmental. You are just, I think it may be a problem. And Ben say, no, it's not a problem. I'm not doing it all the time and all of that. I say, no, then you just be gentle. If the person then refuses to take your conversation or take your... Okay. Now, if the person, I'm just looking at a question, if the person refuses to accept, or you may not be very skilled to do it, then you can invite somebody else, preferably somebody the person respects, somebody the person is familiar with, because one struggle anybody has with addiction is the fear of being exposed. But like I said, if you are struggling with it, please expose it. Expose it, because that whole circle of keeping it secret and trying to deal with it all by yourself is not effective. Many people who have struggled with one form of addiction or the other will agree that even though they tell themselves, I can do this all by myself, it is not effective. So by exposing it, you become accountable. Now, sometimes there may be underlying problems, but let me also quickly say these three things. Every form of addiction doesn't happen in one day. So, for example, you don't become addicted to porn over one event. You become addicted to porn from one mistake after the other. So maybe one day you were bored and then you decide to look at and go to that site, then you continue that habit. It's not going to start the first day that you did it. Same thing with gambling. It's not going to start the first day, but you kept going back, and then you kept using with drugs and all of that. So addiction is a journey, not an event. Also, your recovery will be a journey, not just one day, but it starts with exposing it. And number two, decision. You have to make a decision. Now, I know that you may feel like, I have tried before, I failed, there's no need, let me just keep doing this. No, the fact that you are failing repeatedly still does not mean you should not decide. Make a decision and say, I don't know how I'm going to get out of this, but I decide that I choose to get out of this. And that way it makes it easier for your spouse to help you. So I've talked about being empathic, and then after being empathic and getting it out there, you then have to take practical steps to stop it. So one way you can stop it is reduce your exposure. So there are certain things that triggers you, like for example, gambling. One of the things that triggers gambling is the presence of money. When you have money, you are likely going to use. So you may need to let somebody handle that for the meantime. Addiction is not something you try to say, I will do willpower. So I'll leave you with these three things, then I'll take specific questions. So there's something we call the how. HOW. If you want to win your addiction and you want to help your spouse to win their addiction, you have to practice the how of getting out. H means you have to be honest. You have to be honest with yourself, honest that I have a problem, honest that you have a problem. Denial and trying to cover it up is not going to help. The O is to be open-minded. So you have to be open-minded to options. Many times people that have addiction problems say to themselves, I know how I will solve my problem. No, if you knew how, you will not still be in the problem. So be open-minded. And number 3 is that you need to be willing to take the steps. The steps sometimes may be uncomfortable, but you should be willing. So I hope that we now know how to identify whether I am an addict, whether I'm addicted to drugs, whether I'm addicted to porn, whether I'm addicted to masturbation, whether I'm addicted to gambling. Also, we know how to identify it in our spouse. So identifying in your spouse is that you see a change in behavior, you see them choosing to be isolated, you will see swings in mood. So sometimes the person is irritable, mood swings and all that. You may also see things missing in the house. Those are pointers that the person needs help. And then the first step you must take is you must confront in a gentle way, not in a harsh, not in a useless, in an abusive way, but in a gentle way. And if that fails, please get somebody else. And if that still fails, sometimes people with addiction will promise heaven and earth and say, I will never do it again. If the person keeps going back, please and please and please, you may also need the help of a professional. You may need to call a professional at some point. So to the questions that we have here. Now, I had mentioned that pornography, let me say this, porn has been associated with higher rates of divorce. Associated, whether it is the cause or not the cause, statistics and research does not clearly state that, but it has been associated. It also has been associated with less intimacy in the marriage. There's less intimacy, and another thing that pornography has been associated is so there's less intimacy, and there's also less sexual satisfaction, because when you watch porn. I have watched porn, so I wouldn't deny that I've watched porn. But you see, the thing is that you may start out, it may just seem like a simple thing, but if you don't stop it on time and desist from that, it becomes problematic in your marriage, because then you start having sexual challenges. So yes, some people say, oh, go watch porn, may help your sexual life. That is a no. It may start out, it's called every form of addiction is called the inverted curve. It may start out like it's helping your sexual life, but at some point it becomes detrimental to your sexual life. You now have people literally not having been sexually satisfied. You literally have people, so after sex with their spouse, they still need to go and masturbate, because it will, every addiction, one thing addiction does as a basic principle is that it hijacks your brain. In other words, it takes away the normal cause of pleasure. So normally with your spouse, you have sex with your spouse, you also have satisfaction. But once you're exposed to masturbation and you're exposed to pornography and you become addicted to it, that normal curve of pleasure with your spouse becomes affected. So it's a dangerous thing when people say to themselves, let's go watch porn to improve our sexual life and all of that. And some of those things they do, they are unrealistic, they are not the truth. So then you have people feeling, like I said, sexually dissatisfied and not intimate, because you are not really, you can imagine just think about it. If you're having sex with your spouse and then your spouse is calling somebody else's name, that is no form of intimacy. Or you are having sex with your spouse and you are climaxing and all that, but you are imagining somebody else, that is not intimacy. And so one of the solutions in that case is to learn to talk about sex with your spouse. We're talking about with your spouse here. sex, many people do have sex, but they don't talk about it. They don't talk about, okay, how do we improve? This is how I feel. Like I said, you need to expose it. If you are struggling with it, if you are struggling with it, because, and you see, another thing that sometimes masturbation does is that like still this basic thing, you are not having satisfaction, and you then start going out and all of that. So some of the questions we have here is how to handle spouses with sexual addiction or perversions. So some people have, and that's another thing that it exposes you. It creates perversion to your sexual life. There's less satisfaction, and like I said, it's associated with increased divorce rate. In fact, one statistic says, especially those in 20s, 30s, the only people that is not really associated people above 50. But I mean, really, so it's not a good thing to expose yourself to. And if you have started, expose it to your spouse, talk about it, and begin to put measures in place. So one of the things that often leads to addiction, that is a trigger, is boredom. You find yourself, maybe you wake up at night, or you are bored, and then you are flipping through your phone, and then this thought comes. We call it like the snowball effect. The thought comes, just go to that site. You are just going to check up something. You won't look at it too much. So you need to stop it before it goes that far. Sometimes you may even need an aversion therapy, where you put a rubber band, and every time you feel the urge to do such, you snap out of it, and you may need to talk to someone, your spouse, and say, this is how I feel. But and then celebrate. Don't feel guilty if you fall. Keep working at it. Like I said, make a decision. So how do you deal with spouses having pervasive sex? You need to have a conversation. Please, you need to have a conversation with the person. Some people will be in denial, and you see, that is the thing. It just leads to a lot of that's the word, paranormal sex. Have a conversation. If that is not working, I want to state this clearly. If it is not consented, and then it is you are being affected, please, and your spouse is not listening, engage a third party. That whole thing of, oh, we can't talk about it, we shouldn't expose it. Addiction, and people suffer and are traumatized because they try to keep it secret. Addiction thrives, in secrecy. You must expose it. That's some form of actual abuse. That's some form of abuse when it's not like it's consented. And sometimes the abuse can be emotional abuse. You try to scare the person. Oh, if you don't agree to my sexual fantasies, I'm going to go out. Remember what I said about trying to pay the money for your gambling spouse. You try to pay up. It's not going to solve their problem if you don't solve the prime problem. So don't ever think that, okay, I have to give it to my spouse anyhow they want it, even though it's detrimental to my own health. The thing is that nature and God has made it such a way that there are certain kind of sex that impact on your health. They impact on your health. They are not those, that part of the body is not designed for that purpose. In fact, let me even quickly say this, because sometimes men mistake that whole thing. Now, we're not encouraging this in any shape or in any form. But the truth is this: when a man has sex with a man, there is the prostate that the organ rubs over and then gives him some kind of pleasure. That's a man and a man. A woman does not have a prostate. So when you are having sex with a man from an anus, you are not giving any form of pleasure. That was not the place designed for that. Because how do I know that? Because look, the way God has designed us is that when you have sex in the appropriate place, that place, which is the vagina, has the capacity to become moist, to become wet, as we say. It was designed for that. The anus can never get wet. The anus is not designed to stretch in that shape or form. Many people have caused damages. Their sphincters have been damaged, and then they are having some form of incontinence. So please, if you have do not even consent to it, all in the name of trying to, if you are not comfortable with it, please, I want to stress that. But I would just generally say it's not healthy. I mean, the first set of HIV back in the early 80s was found among homosexuals, and it has to do with anal sex. So I'm not saying that, well, I know some people may be watching and saying, oh, this doctor is just talking off point, but that is the fact. I'm not here to mince words. That is a fact. You could have sex as long as it pleases both of you. That is your business. It's none of my business, but it should be something that is healthy, not something that is detrimental. I mean, you put your penis in her anus, then you take that same penis which has now been there's feces on that penis, then you put it in her vagina. That is unhealthy. That is not. And then you are introducing, because the way the body is that there are some what we call flora. Every part of the body, so the vagina has some organisms that are there and natural to that environment, and then for the anus, and then you are introducing that into that part, you run the risk of having all sorts of maybe cervical cancer, infections, and all that. From infections to cancer, I mean, and that could be terrible. So those things are not. And if you are a spouse being subjected to that, if your spouse refuses to get this, please, the best way to support it is to expose that behavior. That person needs conversation. That person needs treatment. Like I said, if you try by yourself, it may be a fantasy. Yes, it started out that way. Person is struggling with it, but don't think you need to support that at your own detriment. It's not wise. Another question. So we could ask our questions at this point. I think we've answered that about the true anus. Nam said your husband is so hard on you, you bleed and you will faint several times. The process, yet the man won't be gentle with you next time. So I will start again, like I always say. First of all, have a conversation. So have you even had a conversation? Don't assume that because you fainted and all of that, and then you didn't have a conversation, the man should know now, he should see now, or then start avoiding all of that. Have a conversation. And like I always say, have a gentle conversation. If you truly love your spouse, you shouldn't do something to hurt them. Sex sometimes, and this is okay, and this is normal. Sex can be there's something they say you can have pleasurable sex, and then you can have dutiful sex. That is to say that sometimes you have sex with your spouse out of duty. Sometimes you have sex with your spouse out of pleasure, that you both, it's like either when one person is enjoying it or both parties are enjoying it. But it should not always be out of duty, and it can't always be out of pleasure. But the fact is that there should be love. That is the point I'm trying to make. It shouldn't be like you're hurting the other person. So please have a conversation. And if it is not working, I know men are always usually men are shy to discuss these things. They feel embarrassed to discuss these things. Sometimes they that's another thing. You go into denial, hoping the problem will just pass. You see, sometimes these problems are not so big if you get proper information. But we are so ashamed. We stay in the secret. We stay in the dark. And like I have said repeated in this broadcast, that's addiction thrives in secrecy. Don't keep it in the dark. Put it out there. Putting out there is not to go and share it with family members. Please talk to each other. Then possibly talk to a counselor, and then a counselor may then refer you to a professional. But not that you go and call the family members and then you're discussing that kind of thing, because they may not even have any answer. They may not be able to really resolve it. They just see it as a moral issue. Stop, it's not right. If it's an addiction goes beyond just telling the person stop, it's not good. Addiction takes a bit more than that to deal with. Okay, it says another asks, what could someone talk about selling things um, money is missing, rings are missing, all of that is missing. How do you handle that? Confront gently, then escalate. Same principle. Confront gently. They may be in denial. The thing about seeking help is that you may need to, when I say escalate, I'm not talking about escalating to a professional. First to family, let them be involved. But let it not just be the general family. Some family members really don't care about what is going on in your own home. It's your own business. They won't tell you, deal with it by yourself. So, and if you think your family may not handle it well, then escalate to a professional. But don't just, I said that number one, addiction is a journey. Number two, that I forgot to mention, is that usually addiction gets worse if it is not addressed. It gets worse if it's not addressed. So it's not like, it's going to get better. If we don't address the gambling problem, one day the money will finish and his eyes will clear. It usually gets worse. So that's important. And number three, addiction is a primary problem, meaning that if the person started gambling started drinking or using for a certain reason, even when, okay, let me even say this about pornography. Now you may say, okay, I started doing porn because at some point I wasn't having sex with my wife, so to give me some form of pleasure, I started exposing myself to pornography. You realize that even when your wife or your spouse, maybe so it's not, I'm sorry, I'm focusing on the men, but most times it's men that have these problems, but even when your spouse is now available and ready to give you all the sex that you want, you still want to do porn and you still want to masturbate. So addiction in itself is a primary problem. These three things, very important to remember, that one, it's not an event, it's a journey. It starts out, it's one bad decision. Number two, it gets worse most times. It doesn't get better. So you need to seek help. The earlier you get help, the earlier you resolve the problem, the better. And number three, it's a primary problem. That means even when the thing that made you start the problem in the first place is over. Maybe, for example, someone gambled the first time because he was in need of money or whatever, just for the fun of it. He was just bored and he was hanging out with friends and then he started gambling. Even when you are no longer bored, you will still keep doing. So it's a primary problem and you need help. I think I basically answered them while I was talking about it, that what do you do? Your spouse is, after sex, he still has to masturbate. Clearly, he has an addiction. He's addicted to masturbation. And so if you are the one and you love your spouse, expose it, have a conversation. I'm struggling with this. One of the things that you need to, so it's for your system to restore, it will take time. So what do I mean? So this is what you need to do. So after sex, you still need to go and masturbate. Stop it. You may not feel ultimate pleasure. You may feel that pressure, but in that time when you are feeling that pressure, fill it up with something, with a conversation, with an activity. Fill it up with something. When you feel that time, that you feel that pressure, try to distract yourself. When you fill it up, what will normally happen is that after a while, that pressure will pass. Then if you repeat it, you repeat that action again and again. So for this specific question, after sex, you still want to masturbate. So after sex, your natural response is you go straight into the restroom or something, is that, and now you have exposed it to your spouse. So what you do is that follow the person, but it's a mutual thing. Like I said, if you want to win this thing, you have to do the how. H, be honest. O, be open-minded. And W, be willing. It's not about willpower. It's not about, it's about willingness. So be willing to allow your spouse to go with you to that place. It may be embarrassing, but let her go with you, or let him go with you. Hook up. Then another thing too is plan your activities. So if you know that, okay, boredom will normally lead me to these things, or after work I go and hang out with the friends or something like that, plan your day. Go from your place of work straight home. Don't branch and all of that. So that is one way. When you repeat that again, because what has happened is that your brain has become conditioned to doing that act. Sex, go and masturbate. Sex, go and masturbate. But when you have sex, you keep busy. Sex, distract yourself. Sex, I have a conversation with my spouse. Sex, I go and watch TV. Sex, I go and read. Sex, and you are no longer sexing and having sex and going to masturbate. What eventually happens is that it begins to wane, that urge, that desire, and then your brain begins to kind of reset and go back to the natural order. So, in the final question, about someone gambling now, missed missed the naming ceremony, missed the birth of the child because of gambling. There's a serious, and now people are laughing and making mockery and all that. It's a problem, please. It's a problem. Don't take the side of, it's not just a moral issue, it's an addiction, and therefore the person is struggling and can't seem to come out. Be gentle and get help from a professional. But it's not like, oh, I'm tired, I will leave this marriage, or threatening. You can even threaten and leave, and it won't still solve the problem. Because once addiction sets in, it hijacks the brain. Same thing for someone masturbating. Some point, say, oh, if I catch you masturbating again, I will leave you. It's a problem. It cannot, if it was not an addictive problem, the person is embarrassed, wants to stop. He's not even doing it for the pleasure. I mean, after a while, he's not doing it for the pleasure. It's just the strong urge comes all the time to do it. And not even because yes, he climaxes, he has orgasm, but it's just an urge. So that's about it. I hope this last 45 minutes has been helpful, and I hope we have answered all of the questions. So, Morolayo, I hope, Mrs. Morolayo, I hope I have touched everything. Thank you so much for having me. Thank you so much. Thank you so much. I hope we learned something, and hope this is helpful. So that's it. Any questions? I don't think so. So let's all have a good evening, and God bless you.